Welcome to Cultural Awareness and Care. There are many ways to define culture. Listed here on this slide is a definition by Merriam-Webster Dictionary. There are actually multiple definitions in the dictionary, but basically what I want you to look at is as a complex whole. Okay, it involves knowledge, beliefs, morals, laws, customs, and any habits that are acquired by members of society. In addition, it represents the ways a person will perceive, behave, or evaluate the world. Okay, we're going to talk about culture and nursing care. First, I want to talk about Lineker's theory of culture, care, diversity, and universality. When you look at this theory, it's actually includes concepts of culture care. It's delineated as preservation and maintenance, accommodation and negotiation, and repatterning and restructuring. Then we have behaviors. Culture is defined by behaviors that individuals may have, and this is the way that they'll behave to protect their health or to restore their health after they have become ill. Okay, in order to provide cultural nursing care, you must identify your own cultural beliefs and your own behaviors. And able to be competent, you have to understand yourself and your personal values and your personal health beliefs. In order to become culturally competent in providing, competent care, you have to be respectful and understand their client's culture. Another key thing to remember is communication. You're going to communicate with clients of various cultures, and you need to use purposeful strategies. First, you want to assess fluency in English and make arrangements for an interpreter if needed. Speak directly to the client if you are using the interpreter. Be attentive to body language that might offend a client. Learn and follow how client wishes to be addressed. Provide an environment for communication that respects habits regarding eye contact and amount of personal space. Use language that is free of slang or currently popular jargon. Use simple, straightforward sentences. You have to be careful using analogies. If a client, or even metaphors. If a client does not understand, rephrase sentences or the questions. And then prior to giving any written health teaching materials, even if it is in a client's preferred primary language, make sure that you assess the reading ability. Health literacy can affect ability to learn health information regardless of the cultural background. Religious laws can also influence how somebody handles their health, so you will have to bring that into consideration in order to become culturally competent. Cultural-based dietary preferences and religious laws can influence somebody's dietary intake, which can actually affect their medical health. I will provide a brief dietary restrictions or practices. It's not written in stone. I want you to remember that even though somebody may practice a specific religion or have a specific culture, it does not mean they specifically adhere to the specific dietary restrictions or preferences. Another thing to remember is that cultural beliefs about maintaining or restoring health may actually clash with those of the healthcare provider. You want to remain non-judgmental. You want to work with the client. You want to make sure that you're incorporating their religious beliefs or their cultural beliefs and practices in order to design a plan that involves the client. By including cultural beliefs in the care plan, the patient is more apt to follow the health recommendations. Included is a table here that shows dietary restrictions or practices based on some religions. Like I said, remember, you can't, just because somebody may have practice a specific religion, they may not specifically have, follow those restrictions or follow those practices. Okay, so let's look at some cultural considerations for the African Americans. In regards to communication, English is the primary language. They may be called African American Vernacular English, or it may be called AAVE. Direct eye contact may be considered inappropriate. They may use eye rolling in response to communications that's perceived to be inappropriate. They may use silence in response to what is perceived as an inappropriate question. And verbal and nonverbal communication is integral in the communication process. For time orientation, they tend to be present oriented rather than future oriented. Thus, preventative health care may be difficult to implement or maintain. However, time orientation varies according to age, subculture, and socioeconomic status. They may not be punctual for appointments if needs of family or friends require immediate attention. When you look at social roles, the extended family is important. They have a strong sense of obligation to relatives. They value friendships. Many single parent families typically are headed by females. They tend to have large family support systems, and religious affiliation is common. Views of health and illness. The body, mind, and spirit are integrated. Good health is a result of good luck. Thus, individual has little impact on health status. Illness may be a punishment from God, is how they view that. Illness is related to an individual's harmony with their nature. Emotional or personal problems can be resolved through use of spiritualist who is called by God to heal. Voodoo may be considered a powerful cultural healer. And practitioners who use roots, herbs, oils, candles, and ointments may be used in the healing process. Some health risks can be lactose intolerance and lactase deficiency, hypertension, sickle cell anemia, cancers including breast, colorectal, esophageal, stomach, cervical, uterine, and prostate, could have coronary heart disease, coccidioidomycosis, and diabetes mellitus. Some nursing considerations. Avoid stereotyping. An expectation that all people within the same ethnic or cultural groups are alike and share same beliefs and attitudes is stereotyping. You need to avoid that. Include family in the medical care if desired by the client. Allow for flexibility in scheduling appointments. Facilitate and encourage use of folk healers and spiritualists. Encourage family to bring traditional diet if medically acceptable. Okay, so cultural considerations for Asian Americans. In communication, the primary language include Chinese, Japanese, Vietnamese, Korean, and English. They may use silence to demonstrate respect for elders. They may consider direct eye contact to be impolite or aggressive. They may look away as a nurse attempts to make direct eye contact. Unlikely to criticize or disagree with others verbally. They consider the word no to be disrespectful, and nodding one's head or smiling does not always suggest agreement with what has been said. For time orientation, they tend to be present oriented while highly regarding the past. For social roles, they respect aging members of society. Their family bonds are important. They have the large extended family networks that exist with devotion to tradition. It may actually be expected that daughters and daughter-in-laws will care for the older family members as their health declines. They have structured and hierarchical family unit with the men and elders being greatly respected. Women are expected to be subservient to the men. Loyalty to family members is expected and highly regarded. Education is highly valued. Religious affiliation is common, including Taoism, Islam, Buddhism, and Christianity, and traditions are highly valued. When it comes to views of health and illness, Chinese concept of yin and yang is a metaphor for forces of nature being in balance to produce harmony. Illness is a state of disharmony or imbalances of the yin and yang. And foods are associated with the concept of yin and yang. For example, yin foods are cold, whereas yang foods are hot. Cold foods and beverages are consumed for hot illnesses, and hot food and beverages are consumed for cold illnesses. And then illnesses may be attributed to overexertion or to prolonged sitting or lying. Some of the health risks can include thalassemia, lactase deficiency, G6PD deficiency, hypertension, cancer. Some of the common sites are stomach and liver, or coccidioidomycosis. Some of the nursing considerations include that the Asian clients are likely to be quiet and compliant during illness, thus this places them at risk for not having any needs met. They may also wish to take medications with certain foods or beverages believed that will promote the correct balance for health. They often do not trust healthcare providers and wish to include traditional healers along with Western medicine practices. They may expect healthcare providers to be authoritative. They limit their eye contact and physical touching, touch a client's head only with permission from the client or the parent. They may encourage and facilitate family involvement in the care. And then, of course, clients of Chinese descent may expect nurse to intuitively know their disease process. And then, of course, there are alternative therapies such as acupuncture, herbal remedies. These are commonly used by people of Asian cultures. Let's talk about cultural considerations for Latino or Hispanic Americans. Their primary languages can include Spanish and Portuguese among English. They may utilize code switching, which is systematic mixing of English and Spanish languages. They have a desire for smooth or harmonious interpersonal relationships. It's characterized by courtesy, respect, absence of critical or confrontational behavior. They try to avoid that at all cost. Eye contact reflects respect. In nurse-client relationship, eye contact may be expected of the nurse, although it may not be reciprocated by the client. They tend to be verbally expressive. They may engage in small talk, which should be appraised as a method of establishing rapport. And nonverbal communication plays an important role in client assessment and interaction. For time orientation, they tend to be present oriented. However, time orientation varies according to the age, the subculture, and the socioeconomic status. For social roles, family is most valued institution and is the primary source of personal identification. While nuclear families are common, extended families may also exist. The father is likely to assume the role of the head of the household and may be the decision maker for the entire family. There is a collective achievement that tends to be valued more than individual achievement, and religion is important. Catholics is prevalent in this situation. Views of health and illnesses. They refer to the mal de ojo, which is also known as evil eye. It's a childhood disease. It's characterized by fitful sleep, crying, diarrhea. It's a common belief among Latinos that it's caused by unconscious energy of an adult flowing into a child when the adult simply looks at a child. Health is thought to be the will of God. Curanderos is folk healers that may be consulted. And then health may represent a state of equilibrium in the world, which is characterized by balance of hot, cold, wet, and dry. When an imbalance exists, treatment focus is on application of the opposite quality. Some health risks can include diabetes mellitus, hypertension, pernicious anemia, and childhood obesity. Some nursing considerations are that these clients may seek guidance from within family network rather than from healthcare providers. So nurses should include family members in the healthcare education when it's appropriate. The male family member may be the decision maker for the client. Modesty is important, and measures should be taken to protect the client's privacy at all times. The clients may prefer to have a healthcare provider of the same gender. In use of alternative therapies, it's common. It should be explored when the client enters the healthcare system. If possible, facilitate continuation of such services. And then, of course, encourage the family to bring traditional diet if it's medically acceptable. Now let's talk about cultural considerations for Native Americans. This also includes the Alaskan Natives. Language primarily includes Navajo and English. Language involves tonal speech and the pitch which is very, very important. When shaking hands, Navajos tend to extend a hand and lightly touch the hand of person they are greeting. They may appear silent and reserved upon meeting strangers. And as a sign of honor to ancestors, Navajos may state their clan and location of their home. There are other languages used in the Native Americans. So, time orientation. Time exists in a three-point range, including past, present, and future. It's viewed as being primarily present-oriented, with some members being both past and present-oriented. Social roles. They are family-oriented, with biological family being the central social organization. The family includes all members of the extended family. The family members work collaboratively to assure success of a family unit. The male family members may be granted greatest respect and may make the decisions for the entire family. The extended family may care for hospitalized relatives throughout the duration of a hospital stay. And then, of course, they are guided by religion and sacred myths and legends in their health care. Views of health and illnesses. They desire to be in harmony with the environment and the family. They consider that health is not limited to the body. It includes harmony with family, environment, livestock, and supernatural forces and community. Health and religion are considered to be connected. They have healing ceremonies, or they may include like magic, religion, folk medicine. They can also use these for healing, and they may also use healers, and healers can be men or women. The blessing way ceremony is practiced to remove ill health through use of stories, songs, rituals, prayers, sand paintings, and symbols. Navajo medicine men and women may be utilized, including diagnosticians, singers, and herbalists. Diagnosticians diagnose illness, singers perform healing ceremonies, and herbalists use herbs to treat those who have ailments. Some health risks can include alcoholism and chronic liver disease, accidents, arthritis, chronic lower respiratory diseases, diabetes mellitus, heart disease including hypertension and myocardial infarction, HIV and AIDS, influenza, malignant neoplasms, malnutrition that's caused by high rates of poverty, maternal and infant deaths, obesity, suicide, and tuberculosis. Some of the nursing considerations: when possible, accommodate the client's request to attend healing ceremonies that are held outside of the hospital. Respect their desire to be in harmony with their environment whenever possible. Incorporate all medically acceptable practices into their plan of care. Following birth, the umbilical cord may be buried near a place or an object that symbolizes the parent's hope for child's future. And then, of course, encourage active participation of the family in the client's care. Okay, let's talk about the cultural considerations for European Americans, also referred to as Caucasian. Communication. English is the primary language. Eye contact is valued and shows interest and respect. Body language is important in communication process. Facial expression tends to be utilized as part of the communication process. Handshake is used for formal greetings, and personal space tends to be required during communication. For time orientation, considered to be a future-oriented process, we tend to adhere to schedules and time frames. Social roles, the nuclear family is predominant. The extended family does play an important role. Religion is important with a variety of denominations that exist. They encourage children to develop their personal sense of identity. They subscribe to Protestant work ethic values, which stress importance of planning for the future, and individual goals may take precedence over those of family. Views of health and illness. Health is considered absence of disease or illness. Utilize Western healthcare system. For health risk, we're looking at cardiovascular disease, obesity, diabetes mellitus, breast cancer, and thalassemia. So for nursing considerations of the European American cultural competence, respect the client's need for autonomy and personal space, maintain eye contact with the client, include family members in healthcare decisions when it's appropriate and with the client's approval, and make sure that you understand there may be an interest in homeopathic medication or medicine, and you might include that in care plan if it's not contraindicated. Okay, so let's talk about the key points of cultural competence. Be respectful, interested in, and understanding of other cultures without being judgmental. Assess the impact of the client's culture or ethnicity when planning, implementing, and evaluating nursing care. Determine the level of fluency in English and need for an interpreter to aid in the planning care that's going to be effective for the clients with a language barrier. When providing client teaching, consider the client's culture. Demonstrate cultural sensitivity when you communicate with clients. Evaluate client understanding and acceptance of health-related recommendations. Remember, ethnicity, age, environment, family, community, these can all define culture as a whole, which may influence values, beliefs, behaviors, and attitudes towards one's health care. To be a culturally competent nurse, it will include you identifying your own self-influences, remain respectful of others, and avoid stereotyping when you provide your nursing care. This concludes the lesson on cultural awareness and care.